Hi, I'm April. I'm a level 1 nursing student, and my instructor has assigned me to follow you today. Do you have time to give SBAR?
Hi, April. I sure do. All right. We are taking care of Shanana O'Connor today. She's 34 years old, African-American female. Her birthday is 7/23/1980, so she's a full coat. She does have allergy to Bactrim, reaction to sulfa drugs. She gets a rash when she has that. She was admitted yesterday with a fever of unknown origin. And she's been admitted for observation. She does have a history of type 1 diabetes, and she's at end-stage renal disease and on hemodialysis. She had a graft infection 3 months ago, but she's okay now. She's got peripheral neuropathy, retinopathy, and she is a previous smoker. She has complained about general pain of a 4 out of 10, and she has a fever of 101, so we've given her some Tylenol with some relief. Her respiratory rate is good. She's cleared of auscultation. Her O2 sat's 96 on room air. She doesn't have a cough. She's sinus tachy, been running about 90 to 105, and she's got S1, S2. Blood pressure is 138/78. Heart rate's 95. She's got 2+ pulses in her upper extremities, 1+ in her lower extremities, and she's got a +1 non-pitting edema in her lower extremities. She also does have 18 gauge right forearm peripheral IV site that's good so far. Her bowels are active ×4. She's soft, round, not tender. She's continent. She's on a diabetic renal diet. Her last glucose was 155. She urinates rarely, but she's on ins and outs. She's had an intake today of 3075, and her output's been 200. She is on fluid restriction at 15 mils a day. Her skin is intact, warm, with no lesions. She's slightly diaphoretic. The urinalysis that we had done showed a WBC cast count, and so it shows that we think there's a possibility for a UTI. We're waiting for cultures to get back though. We want to watch her when she goes to the bathroom. She's got some tingling in her extremities, so we've given her a call light and told her to let us know when she needs to use the bathroom. Her vitals are Q4 and PRN. We're to notify the doctor if her temperature is above 101, or if her blood pressure goes above 180/100. We're also going to keep an eye on her pain level. Do you have any questions?
Yeah, I do. Why specifically is the client receiving this medication?
We're going to give her imipenem and cilastatin because her urinalysis has showed signs of the UTI. So this is a broad spectrum antibiotic.
Okay. What action does this medication have on the body?
Well, it works on both gram-negative and gram-positive bacteria, and it prevents the protein synthesis of the cell wall and causing cell death. The cilastatin helps to prevent the kidneys from processing the imipenem so fast, so that it kind of stays in the system and can do its job.
Okay. When would you question administering this medication?
I question if she had any allergies to penicillin or cephalosporins. She could have a reaction if she was taking any seizure medications, because sometimes it can lower the levels of the seizure medication. And also if she's pregnant, because it was a category C. Because she is having renal impairment, we're going to check with the pharmacy to dose this correctly for her.
Okay. Does the medication have a therapeutic serum level?
No serum.
Okay. And which vital signs must be monitored?
Okay, well, we're monitoring Q4 and as needed, but really what we want to keep an eye on is the temperature. We want to make sure the temperature is going down.
Okay. And which physiological parameters should be monitored when the medication is being administered?
Well, we want to watch for signs of rash, edema, flushing, shortness of breath, any anaphylaxis, just in case there's an allergic reaction to this.
Okay. And what interventions must be taught to ensure to the client to ensure the medication is administered safely in the hospital setting?
Okay, well, we want to make sure that she calls us if she sees that there's any signs of swelling, if she's having any pain at the IV site, any redness, anything like that. And also, if she wants to get up and move around, we need to make sure that she's calling us so that we can make sure she's not tripping over the IV lines and stuff like that.
Okay. And what interventions must be taught for taking the medication safely at home?
Well, we want to, she probably won't be taking this at home because it's an IV. If she did, though, she'd have to have special training to do that. And we also want to make sure that she knows that in taking antibiotics, you need to ensure that you take them for the entire dose, even if you're feeling better.
Okay. And what are the side effects and potential adverse reactions?
There's a lot of GI side effects, so you have nausea, vomiting, diarrhea. You also want to look out for super infections. Colitis, thrush also can occur. You want to assess for any allergic reaction or rash again.
Okay. And how will you know that the medication is effective?
Our biggest sign is going to be that, immediately is that her temperature is going to go down. We're right underneath 100 and 101, and we don't want to have any pain or infection, but, really we want to also clear your analysis.
Okay.
It's important.
All right. Thank you.
All right, you ready to go in?
Yeah.
Hi, Miss O'Connor. How are you? I'm good. Great. I'm Sabrina. I'll be your nurse. I'm going to give you some saline fluids and also start you on an antibiotic. Do you have any questions for me?
No.
And can you give me your name and date of birth?
I am Shanana O'Connor. I'm 34 years old.
Great. Do you have any allergies? I see that you have an allergy band earlier.
Yes, I am allergic to trimethoprim sulfamexazole.
That's a mouthful, huh? Okay. And what happens when you have a reaction to that?
I get a rash.
Okay. All right. Have you ever had? This is Premaxin, so it's imipenem and a psilocybin. Have you ever had this before or had a reaction?
I don't think so.
So first, when we're gonna, come in and start IVs or anything like that, we want to check the patency and we want to check the IV site, assess the IV site, and make sure it's okay. So what we're going to be looking for is any signs of redness, any swelling, any warmth, or any pain at the site. So that'll be the first thing we're going to do, and then we're going to want to flush the site because we want to make sure that when we do administer the medication, it's going to get to the patient. So are you aware of the side effects of this drug?
I heard my stomach might be upset.
Yeah, you can have some nausea, vomiting, things you relieve if you feel shortness of breath or if you have a rash starts to show up or anything like that. So again, we're assessing the site, and the site's not red, it's not warm, it's not swollen. Is it painful at all? No? Okay. All right, so we're going to go ahead and flush the site. And we're always going to scrub for 15 seconds to ensure that it's nice and clean, and we're not going to transfer anything. Alright, and this is clean. We'll push it in here. Alright, kind of clean. Alright, do you feel any pain? No? That's okay. Great. Alright, I'm going to go ahead and leave this here so I don't have to reclean this. I can just connect the clean, sterile to sterile tubes. Alright. So, again, with any of your, with taking this, I'm going to need you to make sure that you take particular care of your mouth and let us know if there's any signs of any thrush or sores in your mouth, because that could also happen. Alright, so you're going to remove your tubing from the bag, and you're going to want to make sure that you clamp it immediately. This is a clean site. Alright. So that's up. Alright, so first we're going to go ahead and get your normal saline fluid hooked up. And so you always want to let the patient know that they have a right to refuse. So that, if they don't want something, then that's okay. You also want to ensure that it is the right medication, the right route, the right time, the right dose, the right patient. When you are administering the bag, you want to go ahead and look at it, check it out, make sure that it's not expired. So we're going to check both of these bags now and make sure that they're not expired, there's no holes in it, the fluid is clear. Alright. So, alright, and your name and date of birth?
Shanana O'Connor, age 34.
Okay, so that's you.
Meanwhile, go ahead.
And this is your normal saline.
Initials, date, and time.
And it is in your, okay, alright. Your eye. Okay. Then you want to make sure the time is correct, it's the correct dosage. Good to go. Alright. So then you want to start, right, you're going to want to take this off and you're not going to want to touch this. Or we're going to uncap this. Now it's sterile. We're going to
So again,
pull that off and we're going to go ahead and inspect the bag. The back. So because I'm going to do like this medication, I'm going to go ahead and hang this lower. If I wasn't, then it would be a primary bag and I'd just hang it up higher. So that's there, and you're going to want to squeeze the chamber to fill it till it's about halfway.
check the expiration date on both of the bags. I might have done that.
And you're going to insert this into the pot. And you want to prime it first before you do this. I had primed my line, so I made sure that it was primed. And there were no bubbles in it. If you have bubbles, your machine's going to scream at you. Doesn't matter if there's a bubble there. Alright. No bubbles. Now we're good. We're going to leave the top on this, of course, until you connect to the patient. Make sure you leave that clean. Alright, next thing we're going to do is get your medication going.
Yes, that is correct. The duration is going to be 1 hour. Start, make sure it's in clamp, and then
This is going to be infused at 30 mils an hour.
I'll go ahead and type the line. Put my date, time, and initials.
And especially because this is medication, so we're going to want to always double check that this is the correct medication for the client. So you're going to need to tell me again, what's your name and date of birth?
Shanana O'Connor, age 34.
Okay. Alright. And that's good. And this is the right patient, and this is the right medication. And it's the right time.
Okay, so sign the word.
And it's IV.
Okay. Do you have any questions for me?
Nope.
Great, so you have your call light, that's down. And anything, press the call light.
Okay.
Anna O'Connor, age 34.
I have a few questions.
Okay. The right patient now, I have the right medication. See, if you were not in the correct,
Yes, I reviewed
Place,
the 5 rights.
then
Patient gives
the
time
more is great at stopping you from that. So I had also
Oh,
to give
great.
another bag of IV fluids.
Okay.
and then non-saline. So this
That's another reason why we do our 5 checks. So now I've checked this,
It
and
allowed me to
this is
administer
verified.
medication
and
Great.
it's the correct.
appropriately by
Far good for that, it's the correct medication, and now it's the correct
This
time.
information affect how you administer medication? Confirming the YSA compatibility and patent ID allow me to hang the bags and IV infuse medication.
Right. Now, you want to get this out, you're gonna make sure it's clamped again, always immediately clamp
Good.
your bag. You're gonna keep this sterile to sterile, just like the bag. And we've already checked this bag. Then you're gonna wanna
The only thing, I
make sure
tried
that
to
you
start the
prime your
pause
line
because
and
this
not
is
try
the
not to
line,
lose
I'm
any of
like,
the medication too much. You're gonna make sure there's no bubbles
I
there.
can see it.
And then we're gonna hang this up here. And we're gonna squeeze it to make sure that it's halfway full. Another thing that we're gonna do is we're gonna connect it above the pump. And the reason for that is we want to now control the rate of the medicine, the way that it goes in. So that's what we want. Alright, you're gonna scrub this out for 15 seconds. Connect it. Well, I'm gonna leave everything clamped. Alright. We verified everything, now I'm gonna
I was just
connect
smelling
it
myself.
to the patient. So, this is clean still, this is clean, we'll remove this. And we're gonna go sterile to sterile. And now we're connected. Everything is still kinda clamped up right now. Alright, put this here. Okay, so now we're going to turn on the pump.
I was gonna, for someone else.
New patient, yes. Search, yes. And we're gonna do patient ID, which is 824-7823. 824-7823. And confirm. Alright. And guardrail IV fluids. Normal saline, yes. The rate is 30 mils an hour.
Of course, my patient is
And that's gonna be out of 1,000 mil bags, so we're gonna put it 950 because we don't want the pump to dry. So now we're gonna set up our secondary line. We're gonna go over here and we're gonna look under I for Impentin. And it's right here, it's Cilistatin. So we're gonna select that. And we're gonna select the 500 milligrams and 100 mils. That's what our bag is. We're gonna double check that. Okay. And it's gonna say, is this correct? 500 mils and 100 was, yes, this is correct. Okay, so we're gonna hit next, and then we're gonna put in the duration. We want this to run for 1 hour. So 1 mils in an hour. Alright. So verify, it'll tell you, verify the secondary clamp is open. So we're gonna unclamp that. And then we're gonna come down here, check and make sure everything is open. Okay. And we're gonna hit start. Now that's going. We're gonna make sure that we watch for 5 drops in each one of these to make sure they're going. The last thing you wanna do is walk out and it's not actually working, so. Alright.
Reflexes are 1 plus symmetrical bilateral. She denies.
Alright, and then you want to always make sure that you're labeling both of your lines. So I've got labels here, and I've got my date, time, and initials that I did this, and these lines will be changed out every 3 days. Sure. Okay. do you have any questions for me?
No.
How are you feeling?
Good. I don't feel any pain at my side.
You know, pain in your site? Okay. You're not feeling woozy or coming up here a little bit? Okay, and again, look out for any signs of thrush in your mouth, any kind of sores. Definitely call us on the call if you get nauseous or if you're feeling any, diabetes, vomiting or diarrhea. Make sure if you get out of bed, you're going to give us a call because, you have the IV hooked up now. We're going to want to help you to get to the back room. So I think that's all. I'll be back with a patient teaching. I don't know here. I have a patient teaching. This is about your medication. So you can feel free to read that and I'll come back and make sure you're okay with that. Alright. So, all done there. And again, give us a call if you need anything. See you in a little bit.
Okay, thank you.
This thing is
Alright. Any questions for me?
Yeah, I do, actually. Were there any pertinent pieces of information you reviewed before administering the client's medication?
Well, we definitely looked at our, preliminary urinalysis, the white blood cell count, and it had showed CAS. We also, because she has kidney or renal failure, we discussed it with the pharmacologist or pharmacist so that we knew that it was dosed correctly for that. We want to know when her last dialysis treatment was, her latest vitals, and her allergies.
Okay. Did this information affect your decision to administer the medication?
Yeah, we definitely wanted to make sure that we called the physician, but if there was anything abnormal about any of those, then we would have held the medication until we could get further clarification.
Okay.
But everything was good, so we were okay.
Did this information affect how you administered the medication?
We administered it how it was meant to, be administered. It was, ordered IV, so we went with that.
Okay. Well, thank you.
All right, thanks so much.
she's just